Hi there, you're welcome to DemiRx Care channel, where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a subscription gift to you, we would like for you to download a free meal recipe that we do have here at DemiRx Care. So go ahead and click on the link down below in order to be able to download or view that. Thank you so much for watching and stay tuned. Hi there, so today we're also going to be talking about urine dipstick. So urine dipstick in order to help you find out if you have UTI from home. So if you were able to see our other video, you should have been able to watch how to treat a UTI, how to diagnose it, pretty much how they do that whole process for prevention as well as for treatment. But if you didn't see it, I'm gonna link it somewhere in this video. That way you can tap and be able to watch it after watching this video. So this is what the urine dipstick looks like. I actually have the CVS brand, and pretty much it says urinary tract infection test strips. So you can get the off brand, or you can get the brand name, which will be your AZO test strip. Alright, so how do you test a urine dipstick to check UTI? In 2 minutes. I mean, you want to be able to find out to make sure that you have a UTI before you start taking your AZO, which is going to be your phenazopyridine over the counter. Alright, so first thing you want to do is make sure that you cleanse your vaginal area if you're a female. So making sure that you're spreading your labia is what it's called, and making sure that you're cleaning from front to back. Or if you're a man, you want to make sure that you're wiping the tip of your penis area before you're testing or using this dipstick. Alright, so then you want to begin by urinating in the toilet. So when you urinate, there are 2 steps that you can take. So you can either do the collection container method, or you can do the urine floor method. So whichever one works for you, but I'm going to talk about both methods that you can actually use. So the first one, which is going to be your urine collection method. So you want to make sure that you get a small container or a small collection container, and you want to put it and use it to get some of your urine stream. So it's usually recommended for you to pee a little bit into the toilet before you actually catch the urine using your collection container. So you want to pee a little bit and then put your collection container to collect some pee or urine. So usually they recommend about 1 to 2 ounces of urine, which would be about 30 to 60 ml of urine to go inside that container. So once you finish grabbing that container, then you want to get out your dipstick, making sure that you're also doing it with clean hands as well. So you want to make sure as you grab the container, another thing that you want to make sure is that you have your paper towel. So grab your paper towel, your collection container, and your urine dipstick. So as you collect the urine, make sure you set the urine container on the table or wherever the counter, wherever you have close to you or surface. You want to make sure that you set it there, and then with your AZO, you want to make sure that you're putting a few drops of the urine on your AZO test strip. And usually with this, you want to set a timer. So a good thing about the collection container is that you can actually collect the urine while you're peeing, set it on the counter, wipe yourself from front to back, wear your pants or skirt back, and then you want to wash your hands, and now put some of that urine drop on the dipstick. And once you put the urine drop on the dipstick, you want to make sure that you're setting a timer. So usually you set a timer for 1 minute, and for that 1 minute you're actually testing for nitrate or nitrite. And the second minute you set another timer for another 1 minute, and that one actually checks for any leukocyte, which would be your white blood cells in your urine. So why are you looking for these things? Your nitrite, the reason why you're looking for this is usually the bacteria that causes UTI will convert nitrate to nitrite, and usually if you have UTI and your the urinary dipstick is actually testing positive for nitrate, then it's one of the alarming signs that you might have UTI. However, if it doesn't show, then you want to make sure that you're following up with your healthcare provider. So for the leukocyte, why are we checking for leukocytes? So usually when there's an infection going on, there's more of our white blood cells going towards that area. So usually if there's more white blood cells spewing out through your urine, then it might be an alarming sign that you do have some type of infection going on in your urinary tract area. All right, so that is pretty much the little spiel about using a urinary container. So basically you want to get a urinary collection container, a paper towel. Make sure you have a surface where you can place this, as well as your dipstick, and you want to make sure that you get some gloves. That way everything doesn't get too messy and you're holding your hand with the urine, and then the urine is on your hand, and then you have to press your phone and set the timer. So usually you want to make sure that you're wearing some gloves until you're able to put that urine on that dipstick, and then you can take off your gloves and set the timer and actually be able to time the urine test strips for it to get the accurate results. All right, so